Today, we're talking about Humalog Mix 75 to 25 Vial, which is a combination of two man-made insulins, intermediate-acting insulin lispro protamine and rapid-acting insulin lispro. It's used to control high blood sugar in people with diabetes, by allowing the body to properly use sugar from the diet. This helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. It also lessens the risk of a heart attack or stroke. It starts working faster and lasts for a longer time than regular insulin, and should be used along with a proper diet and exercise program. The daily dosage and optimal timing for taking this medication should be determined by your healthcare provider, based on your individual needs. Before starting to use Humalog Mix 75 to 25 Vial, it's important to read the patient information leaflet and ask your doctor, diabetes educator, or pharmacist any questions you may have. Make sure to learn all the preparation and usage instructions from your healthcare professional and the product package. It's important not to inject cold insulin because it can be painful. The insulin container can be kept at room temperature. Before measuring and injecting insulin, wash your hands and check the product visually for particles, thickening, or clumps. Do not shake the container, instead gently roll and turn it between your palms at least 10 times. If using a cartridge or pre-filled syringe, gently mix the insulin until it appears evenly white and cloudy. The dosage of Humalog Mix 75 to 25 Vial is based on your medical condition and response to treatment. It's important to measure each dose carefully and use exactly as prescribed by your doctor. The usual dosage is twice daily, 15 minutes or less before the morning and evening meal. Before injecting each dose, make sure the injection site is clean and dry. Inject this medication under the skin of the abdomen, upper arms, or thighs as directed by your doctor. Do not inject into a vein or muscle. Eat promptly after taking this insulin to avoid low blood sugar. Change where you inject each time and do not inject into skin that is red, swollen, itchy, or damaged. Do not mix this product with other insulins or use it in an insulin pump. And do not change brands or types of insulin without directions from your doctor. It's important to use this medication regularly as directed by your doctor, and to carefully follow the insulin treatment plan, meal plan, and exercise program recommended. Monitor your blood sugar on a regular basis and keep track of the results to share with your doctor. If you are measuring doses from vials, do not reuse needles and syringes. If you are using the cartridges or pens, use a new needle each time and do not share your pen device with another person. Finally, tell your doctor if your condition does not improve or if it worsens, your blood sugar is too high or too low. If you experience any injection site reactions such as pain, redness, or irritation, or if you notice weight gain, it's important to let your doctor know. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. However, it's important to be aware of any serious side effects, such as signs of low potassium levels like muscle cramps, weakness, or irregular heartbeat. Taking too much insulin can cause low blood sugar, or hypoglycemia. This can happen if you don't consume enough calories. Symptoms of low blood sugar include chills, cold sweats, blurred vision, dizziness, and weakness. It's a good idea to carry glucose tablets or gel with you to treat low blood sugar, and if you don't have those, you can quickly raise your blood sugar by eating a quick source of sugar or drinking a glass of fruit juice. Let your doctor know right away if you experience these symptoms. On the other hand, symptoms of high blood sugar, or hyperglycemia, include increased thirst and urination. If you notice these symptoms, it's important to inform your doctor. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you experience a rash, itching, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. Before taking Humalog Mix 75 to 25 Vial, make sure to let your doctor know if you have any allergies to insulin or other ingredients in the medication. Also, inform them of your medical history, particularly if you have kidney or liver disease. It's important to avoid using this medication when you have low blood sugar. Be aware that you may experience blurred vision, dizziness, or drowsiness due to extremely low or high blood sugar, so it's best to avoid activities that require alertness or clear vision until you are sure you can do them safely. Limit alcohol consumption while taking this medication, as it can increase the risk of developing low blood sugar. Also, be mindful that controlling your blood sugar may be more challenging during times of stress, such as when you have a fever, infection, injury, or surgery. In these situations, consult your doctor as it may require a change in your treatment plan. If you're planning to exercise, remember to check your blood sugar before and after, and you may need a snack before exercising. And if you're traveling across time zones, ask your doctor about adjusting your insulin schedule. For pregnant women, it's important to discuss a plan with your doctor for managing your blood sugar during pregnancy, as it may cause or worsen diabetes. Your doctor may need to change your diabetes treatment, including insulin, during your pregnancy. If you are breastfeeding, consult your doctor before taking this medication, as your insulin needs may change while breastfeeding. When taking Humalog Mix 75 to 25 Vial, it's important to be aware of any potential interactions with other medications you may be taking. Some drugs can affect your blood sugar levels, making it more difficult to manage. Be sure to talk to your doctor or pharmacist before starting, stopping, or changing any medication, as they can advise you on how it may impact your blood sugar. It's essential to monitor your blood sugar regularly and share the results with your doctor. If you experience symptoms of high or low blood sugar, let your doctor know right away. They may need to adjust your diabetes medication, exercise routine, or diet to ensure optimal management of your condition. Additionally, certain medications like beta blockers and some eye drops may mask the usual symptoms of low blood sugar, such as a fast or pounding heartbeat. It's also important to check the labels of all your medications, as some products may contain sugar or alcohol, which can affect your blood sugar levels. Always consult your doctor or pharmacist before using these products safely. Furthermore, certain medications can impact the results of urine tests for sugar or ketones. Be sure to consult your doctor or pharmacist for more information on this matter. If someone has taken too much Humalog Mix 75 to 25 Vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include a very fast heartbeat, changes in vision, unexplained heavy sweating, agitation, fainting, and seizures. It's crucial to act quickly in these situations to ensure the person receives the proper medical attention. It's important not to share this medication, needles, or syringes with anyone else. If you're taking Humalog Mix 75 to 25 Vial, it's a good idea to attend a diabetes education program to learn more about managing your condition with medications, diet, exercise, and regular medical exams. Be sure to learn the symptoms of high and low blood sugar and how to treat low blood sugar. You should also check your blood sugar regularly as directed and make sure to attend all medical appointments and lab tests while taking this medication. It's a good idea to wear or carry identification stating that you have diabetes and are using this drug. This can be helpful in case of any emergency situations. Make sure to follow your insulin regimen carefully and never miss a dose. It's important to have extra insulin and supplies on hand, as well as a spare syringe and needle. Talk to your doctor about what to do if you miss a dose or a meal in the future. When using Humalog Mix 75 to 25 Vial, it's important to store all unopened insulin containers in the refrigerator, but do not freeze them. If you are using the vials, store open vials in the refrigerator or at room temperature away from direct heat and light, and keep them in the carton to protect from light. Cartridges and pens that are currently in use should not be refrigerated. Remember to discard cartridges and vials in use after 28 days, and pens in use after 10 days, even if there is insulin left. It's also important to keep all medications away from children and pets. When it comes to disposing of this product, do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.